Rage and Mystery of the Week, Dr. Bob Martin Show, Sundays at 10 a.m.
If you're sick and tired of being sick and tired, tune in to the Dr. Bob Martin Show. From erectile dysfunction to eczema, heartburn to headaches, carpal tunnel to how to lower cholesterol drug-free. Sunday mornings at 10 on Talk 1470 WNN.
People are learning in a classroom how money is made from home at Online Trading Academy. Just how much?
$100, $200, $300. They were able to get to $500 a day in a little over 8 months. $500 a day, folks, is $10,000 a month.
Get classroom instruction on how money can be made from home and how risk is limited. Learn stocks, options, futures, forex. Learn step-by-step from professional traders at Online Trading Academy.
Everyone starts off very small baby steps. You know, if you can't average $100 a day, there's no way you're going to be able to make $300 a day or $3,000 a day in the markets.
Thousands have learned how money can be made from home with limited risk at Online Trading Academy. Attend a free half-day class to see how it works in Broward and Palm Beach. Online Trading Academy. Call now. 561-674-9800. 561-674-9800. That's 561-674-9800.
Talk here, talk there. Talk 1470 AM and 95.3 FM, the Health and Wealth Radio Network. WNN.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Are you a family caregiver? Are you caregiving for someone who can no longer take care of themselves? Are you overwhelmed? This is Caregiver Solutions Info with Marcia Teele. Marcia will be hosting an hour of true stories and information, tips and updates of the latest research and necessary information in the caregiving field, focusing on you, the family caregiver. An Alzheimer's disease and dementia care expert, Marcia has 15 years of hands-on experience at Arden Courts, a leader in assisted living dementia communities here in the U.S. Marcia covers everything you need to know as a family caregiver, especially if you care for a loved one with Alzheimer's disease or other related dementia or chronic illness. If you have a friend or relative that is also a family caregiver, call them now. They won't want to miss a minute. And let them know they can watch on CaregiverSolutioms.info. And they can listen on WNN 1470 AM in South Florida or nationally on the iHeartRadio app. Now, sit back, relax, and learn from our host, Marcia Teele, as she brings information to you that may just be the caregiving solution you need.
Hi, everyone, and welcome to Caregiver Solutions Info Program. I'm so happy that you could join us today. I'm your host, Marcia Teele, and we are live from Boca Raton, Florida. So this program is for anyone who's interested in learning more about dementia, specifically Alzheimer's, other types of dementia, or about caregiving. Caregiving is a very, very difficult job, and if you're a caregiver, you don't need me to tell you that. You are living it. But caregiving isn't something that one size fits all. You don't learn about it before you need to do it, and so it can be very daunting, very confusing. And so this show is brought to you to help kind of pave that way and give you a little bit of advice and expertise from our guests who can help you in all of your caregiving challenges. We have a great show again for you today. We have many experts in the field that lend their expertise to any kind of field that's related to caregiving, from the legal, from the medical, from the social, from the economic, lots of different fields that all have been affected by the fact that people need to be taken care of that can't care for themselves because of dementia. It's becoming so big, so large, it's scary. And so we need to cover all the bases. So today we're going to be talking about something that all of us eventually, hopefully, will get to that point where we need more information and help and guidance when it comes to our health insurance. Now, if you are a baby boomer and you're getting close to 65 years old, that's the age that Medicare kicks in. But what do you know about it? What do you do about it? How do you know what to do? There is so much information, and somehow all of a sudden you're close to 65 and everybody's bombarding you with lots and lots of information. So it can be overwhelming. Or if you've been on Medicare for quite so many years, and maybe you're an adult child whose parents have been on Medicare for a long time, but now you're considering what they call a Medicare Advantage plan. What is it? Is it the right thing for me? How do you know? What are the do's and don'ts? What are the advantages and the disadvantages? Well, my guest today is going to sort all that out for us and more, and is going to give an explanation in simple terms that will hopefully make it easier for you to figure all of this out. She is a specialist when it comes to insurance in the health field. She's a licensed insurance agent specializing in health insurance and Medicare benefits. And she is joining us via telephone, and her name is Toby Saval, and she is from the Saval Insurance Group. So I'm going to welcome her now, and let's talk to Toby. Are you there, Toby?
I am, Marcia. Thank you so much for having me today.
Well, I am so excited that you're here. We have your beautiful picture up on our screen. So if the viewers are watching us on CaregiverSolutioms.info, which is the website that we live stream from, they can see your beautiful face. And if our...
Thank you.
You're welcome. And if our listeners are in the car or in their home listening on the radio in Southeast Florida, then they can hear your beautiful voice. And so we're going to get into this big discussion. We've never really talked about it on this program, and I think it's really, really important to discuss Medicare, because as we age, you know, that's something that we're all hopefully going to get to experience. And so, Toby, tell me, how long have you been doing in the insurance field?
I've had the great pleasure of being in the insurance field for the past 12 years.
Okay, and during that time, have you seen a lot of people that are bewildered?
Absolutely. When you approach turning 65, I would say about 6 months prior to that, you are inundated in your mailbox with all kinds of advertisements from many, many, many different insurance carriers about wanting you to, soliciting is the best word to use, to try to own one of their plans. And it gets very confusing with all the plethora of different information. So you end up bewildered and you don't know what to do first. You know, one insurance company says, oh, this particular option is the best option for you. Another one says, oh, I even have a bigger and better opportunity for you when you turn 65, et cetera, et cetera. And then you end up getting very anxious and you don't know what to do. And it is really daunting.
Well, I don't know how or they get your information, but it seems like you said, all the insurance companies get your email address, they get your mailing address, and I've witnessed this even in my own family with other relatives who, like you said, approaching that magical age, and they are the kind of people that, you know, at least can analyze things and break things down, but there are so many people that that's just not their thing. And you know, I've actually had people that say, I don't know what to do, so I'm going to do nothing. And then, of course, that's not a good thing either. So I'm glad that you're here to help us with all of the ins and outs of Medicare and what people should be doing and some pitfalls that they should watch out for. So let's go ahead and get started with that. As baby boomers, you know, are aging and they do get all this information, what's one of the first things that maybe they should be considering?
The first things they should be considering is basically what their needs are and what their budget is. Because Medicare Part A will cover 80% of your hospitalization. Medicare Part B will cover 80% of doctor visits and outpatient surgery. So the question becomes, what do I do with the 20%? How am I able to comfortably afford to cover that 20%? And that's when you get, basically there's two options for you. And when I meet with people, again, I get a medical history, what kind of medications they're currently taking, and they give me an idea of what type of budget that's comfortable for them.
So, Toby, right there's a big misconception, and I've talked to a lot of people in their 60s, that haven't experienced this yet, and they think Medicare is free. It's not free, is it?
Right. No, not at all.
But I mean, people are working and saving, and they think, gee, when I get to 65, Medicare is going to take care of all of my problems and my medical. But I think, they're very much misinformed.
Yes, absolutely. You're right. You couldn't have put it better, Marcia. They are misinformed because they've got this image in their head saying, oh, when I turn 65, I won't have to worry. The government, with Part A and Part B will cover everything. But that is not the case. It covers a certain percentage, the 80%, and then you're left with that gap, that hole of the 20%.
But is the 20% a big deal?
Yes.
And why is it a big deal?
Because, for example, if God forbid you have to be hospitalized, Medicare will pay 80% of your hospitalization, but you have to also meet a $1,340 deductible for the first 60 days that you're in the hospital.
Wow.
That could be very expensive. And each day, from day 61 to day 90, there's a $335 a day co-payment, which, if God forbid you're very, very ill, can add up to $10,050.
So even on Medicare, there's co-payments.
Correct. Yes.
Okay.
Exactly.
So people are used to co-payments. If they're working, they have work through their employer. There's co-payments to meet and deductibles and things like that. So really, they need to know about how that works in Medicare because, it's not going to cover everything. So what I hear you saying that because if you have a medical problem that lands you in the hospital, and hospitals are expensive, everybody knows that 20% that is your responsibility can be extremely expensive, especially if you're not very wealthy and haven't saved all your money and put it in a pot for these kinds of things. That it could actually break the bank, couldn't it?
Totally, absolutely. Tragically, people go bankrupt from not having enough savings to cover these co-payments. If they don't have like an emergency fund already saved up, for example. There's a really, really serious problem because there's nothing more important than health, and you want to make sure you have enough financial responsibility to cover these health cost needs.
So you mentioned there's two ways to go about covering that 20%. What are those two ways?
Yes. The two ways there are either, number one, to own a Medicare supplement, or, or number two, a Medicare Advantage plan.
What about a third way of paying private pay out of pocket? I mean, people could do that, couldn't they?
Yes, they certainly can, but you have to be extraordinarily wealthy to be able to do that.
Okay. So most people don't do that option 3 then, right?
Correct.
There's really no advantage to it because the insurance that you buy for the 20% probably in the long run is a better deal.
Yes.
Okay. So now, you've got this 20% to worry about, and there's a lot of questions about that too, because first you're learning the ins and outs about Medicare, and now you have to deal with, you said, a secondary type of insurance. Explain that.
Yes. You mean the options of the Advantage plan and the option of a Medicare supplement?
Right. What are the differences?
Sure. The differences are with a Medicare supplement, they are all standardized, first of all. They're administered from the federal government. So it doesn't matter which carrier you select. all the different plans, supplements, are going to be exactly the same comprehensive benefits. Like a Plan F, for example, is going to be the same Plan F no matter which insurance carrier you elect to own it from.
As far as the benefits?
Yes.
But the price could be different, right?
Very different. Yes.
Aha. So that's when it gets tricky.
Yes. And what most people don't understand, and I want to shed some light on this, is that let's just say, for example, Company X offers a Medicare supplement to you for an extremely low monthly premium. And it's all, by the way, Medicare supplements are age banded. Like, for example, if you're a female, age 65, non-smoker, whatever the price is of the monthly premium, you'll pay. And then if for any reason you don't want it from the same company in 3 years, you go to Company Y, and you're a female non-smoker, age 68. Well, it's going to be different. You're not going to be getting into the Medicare supplement at the same beginning rate that you got in when you were age 65.
So if you're going to switch, then you could end up paying more, where if you stayed, it could be a better deal for you, right? And how do you know if you should switch or not?
Well,
it's complicated.
It's complicated. I mean, it depends on why you want to switch. Like some people want to switch because they want a certain type of customer service that they're not getting with their current plan, and they want to be able to talk to a person rather than having to call in and get a whole different menu of options and then waiting online for a long time. So I think customer service is very, very important, as well as claims history, how quickly the carrier will pay the claim. That's very important. But another thing that most people don't realize is that the individual carrier's history, like if you get in at a very low rate, you have to find out their company history of how much they raised the rate in 5 years, for example. So you could be starting out with a company that's got the lowest rate, for example, and then 5 years they've raised the monthly premium so much that you're like, whoa, I wasn't expecting all of this. Like they could raise it 30-40%, whatever they want.
Really?
So, yeah. Mm-hmm. So a lot of times you just have to be careful that the carrier's claims history, their rating from Standard & Poor's, and 10 years from now, let's say, what is their average rate that they're going to raise you? Because some companies start you out at a moderate premium that's not the highest, that's not the lowest, but it's somewhere in between. And then after a 10-year period, you're not paying a whole lot more than you were when you started out originally.
Wow.
So
we haven't even begun to scratch the surface on this Medicare health insurance supplement situation. And it's already like, to me, there's so many options. There's so many questions to ask. So I have so much more to talk to you about this, but we're going to take our first commercial break. And when we come back, we'll be joining Toby again for a lot more help on all of this. Stay tuned.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides.
Hi, I'm Michael Mole, owner of Senior Helpers of South Palm Beach. Senior Helpers is dedicated to providing quality care in your home with bathing, dressing, grooming, general housework, meals, and more. Our caring and licensed caregivers love what they do, and they'd like to help you too. Specifically trained in Alzheimer's, dementia, and Parkinson's care, our caregivers can help anytime from 1 hour to 24/7 or live-in. Call Senior Helpers today at 561-969-9990 and let us know how we can help you.
You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CaregiverSolutioms.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
And we are back, and my special guest today is Toby Saval, and she's joining us live on the telephone, and her picture is streaming live if you're watching on your computer. And we're talking about Medicare and Medicare benefits and insurance and all that's involved in the cost. And Toby, I have to go back to a question that I am burning to ask you. Before our break, you talked about sometimes if you have a supplement plan that the insurance company can raise it. I mean, you said something like you could go up 30-40%. Isn't there a cap that these insurance companies can only raise up to a certain point on these supplemental plans, or it sounds like it's unlimited?
I'm not aware of any cap that they have. And what I mean by 30 or 40%, it's not usually within a 1-year period of time. It's usually over a couple of years.
Okay. And for our listeners, Toby, I'm going to ask you to speak a little louder so we can hear you better.
Sure.
Okay.
Sure. Is that better?
So you're explaining the supplement from Medicare to something to cover that 20%. So you're on the first option, right? So recap the first option for us.
Sure. In order to fill in that 20% that you would owe if you did not have a plan, if you just had original Medicare, and by the way, original Medicare is also referred to as Part A and Part B. So the 20% needs to be filled in, and your options for that 20% to be filled in are either a Medicare supplement or a Medicare Advantage plan.
Okay, so under the Medicare supplement, you said there's lots and lots of different insurance companies you can choose from, but I mean, there's like dozens, right, to choose from?
Yeah. Mm-hmm. Correct.
So you have to go in and research each one, find out the not only that what they provide, because you said the benefits are going to be pretty much the same. What you're looking at are all the other qualifiers, including price, customer service, claims benefits, as far as how fast they pay, how solid a company they are, so they're not going to go, out of business. That's a lot of work for somebody to take on, don't you think?
Sure, absolutely.
And so that's why people would ask you these questions, because you have all of the answers pretty much at your fingertips, being in the industry and being a licensed agent dealing with all these supplemental plans. So, I mean, one way to get through it would be to ask an expert, I would think.
Oh, absolutely, yes.
Okay, so we talked about the supplement. Then there's an option 2, and that's for Medicare Part B, option 2. Can you explain what that is?
Well, for Medicare A and B, there are 2 options.
Okay.
And the second option would be what they call a Medicare Advantage plan. And Medicare Advantage plan is also referred to as Medicare Part C. And
okay.
These plans have the same coverage as Medicare Part A and Part B, and sometimes they also include additional benefits, like some basic dental services, like checkups and x-rays, or some of them even include some gym benefits. Some of them may possibly include a benefit for some, like to visit an optometrist, to get your eyes examined. They're all different with Medicare Advantage plans.
Okay, so
And
an Advantage plan, a Medicare Advantage plan, back in the day, we used to call those HMOs. And a health maintenance organization would offer a Medicare Advantage plan. But what I hear you saying is the advantage, as part of the name, is that sometimes there's extra benefits thrown in that traditional Medicare would not cover. Is that right?
that's exactly right, Marcia.
Okay. And why would somebody then, go that route?
Different reasons. First, let me just start out by saying, with Medicare Advantage plans, there isn't standardized plan. Each carrier has their own Medicare Advantage plans, and they're different. Whereas with a Medicare supplement, if you get one of the supplements like G or F, for example, they're all standardized. They're all going to be exactly the same, Plan F or Plan G. The only difference is going to be which private insurance company administers them and the monthly premium that they charge for the Medicare supplement. So with Medicare Advantage plans, Company X can have 6 of their own, a PPO type of plan, an HMO, or a point of service. And a point of service, also called a POS, is like a little bit of both. A little bit of the characteristics of an HMO and a little bit of the characteristics of a PPO. But there is no standardized Medicare Advantage plans. And therefore, some carriers will say, okay, with this HMO type of Medicare Advantage plan, we are going to have an added value of x-rays for dental work, one visit for your dentist a year. We'll cover that. We'll cover a gym benefit. You could go to the gym and, we'll take care of that.
So it's like a little carrot they're dangling in front of you to say, "Okay, come to us, use us. We're going to give you a little extra."
That's perfectly put, Marcia. Yes, but also another thing about Medicare Advantage plans. This is crucial. Some of them offer an embedded Part D prescription drug plan in them, and some do not.
And that's real important, especially as we age. We want to be sure that our medications are covered, especially if someone is on, many medications, and medications can be so expensive. I knew a lady who was a caregiver for her husband, and he had dementia, and of course she had to pay a lot of her income toward caring for him and getting him proper care, that she was not even filling her own prescriptions that the doctor ordered for her because she was trying to save money to use it for her husband. And that is just unbelievable, but people do it because they may not have coverage, and medications are so expensive. So let's talk a little bit about that part of the medication that may or may not be included, and what are some of the differences with that?
Sure, that's a great question. First, I just want to clarify one really, really crucial point. With a Medicare supplement, there is no inclusion of a Medicare Part D prescription drug plan. So if you elect, excuse me, please, if you elect to get a Medicare supplement, you have to also get a standalone Part D prescription drug plan. That's really important. And it's really important because when you turn 65, if you choose not to get a Part D prescription drug plan at that time, and let's say 3 years later, all of a sudden you develop a high cholesterol, high blood pressure, God forbid diabetes, and then you're taking 5 or 6 different prescription drugs, and you say, I really need this prescription drug plan. Well, there's a penalty. You could still own one, but you're going to have to pay a penalty for the rest of your life.
And is the penalty pretty stiff?
Not really. No, it's something like 1%. I can't remember, and I don't even want to do the math. Because,
yeah, we want to get into two of those details because it all depends on what plan it is and all depends on what kind of all of that. But the point is you're penalized if you wait, is what you're saying.
Yes, exactly.
So
that's why.
If someone,
when they turn,
I'm sorry.
Yeah.
I'm sorry. If somebody waited and they're going to be penalized because they didn't want to get a plan for an insurance plan to cover their medications. Would you say that sometimes if they go ahead and get it, whether they need it or not, and they're paying the premium, that over the long haul or in the big picture, they would be better off because even though they're not utilizing that benefit now, but they have that possibility of using it, and then later maybe they're better off because of the fact that maybe they might need it. I mean, sounds to me like that would be a hard call.
You're right. And I think definitely when they first enter age 65, to get even the least expensive plan that there is on the market, get locked into that, I would advise people, because most people sooner or later are going to need at least some kind of prescription medication down the line. And it's better initially to get even the least expensive plan that's out there rather than a couple of years later down the road, wait, and then, oh my gosh, I've got this penalty that I have to live with for the rest of my life. And most people that I've worked with, it bothers them, the principle that they have to pay a penalty, even if it's not a tremendous amount of money.
It's just a point of contention. It's like, just the fact it's the principle of the thing that I have to do it where I didn't have to do it before.
Exactly. Yes.
Yeah.
So that's why, I advise people get locked into even the least expensive plan, because you never know. I worked with somebody a couple of years ago that had a family history of, her parents and extended family living well over the age of 100 and had excellent health. So she said to me, something, I've decided I want a Medicare supplement, but I don't want the Part D prescription drug plan because of my family history. And she said, I feel wonderful. I exercise all the time and I do all the right things. I eat health foods, etc. So 4 years later, she calls me up and she says, oh my gosh, you're never going to believe this. She was diagnosed with about 4 different medical conditions.
Wow.
And she needed, I'm going to say, if I remember right off the top of my head, at least 8 different prescription medications. And they were not inexpensive medications, unfortunately. So long story short, she was so remorseful that she did not initially get even the least expensive plan because she goes, I had no idea. I'm the only one in my family that, developed all these medical conditions. And, nobody has any foresight as to what's going to happen in the future to them.
Well,
So
you're right. I mean, we don't have a crystal ball, so be like a Boy Scout or a Girl Scout and be prepared, right?
Exactly.
Yeah.
Exactly.
We're going to take a quick break, and when we come back, I want to ask Toby about formularies. So if you don't know what that is, stay tuned. We'll be right back.
Do you need the advice of an elder law attorney? Perhaps you find it difficult or overwhelming getting to appointments. The solution is Heidi Friedman of Becker and Polyakov. She brings elder law to you by meeting with you in the comfort of your own surroundings. In practice since 1994, Ms. Friedman is a member of the elder law section of the Florida Bar. She and her team help families with issues that include estate planning, asset preservation, incapacity, veterans benefits, and other legal issues that seniors may face. Call Heidi Friedman at 954-364-6021. She brings elder law to you. Are you a senior? Do you need help in your home? Then you need Senior Helpers, an accredited and licensed home health care agency in South Palm Beach County. They can help with housework, meal planning, medication management to make daily living easier for you or your loved one. They can also help with bathing, dressing, and grooming to minimize falls and keep you looking your best. Call Senior Helpers today at 561-969-9990 for a free in-home care consultation. They'll give you help and peace of mind. You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CaregiverSolutioms.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
We are back. My special guest today is Toby Saval of the Saval Insurance Group, and Toby specializes in health insurance and Medicare benefits. So that's what we're talking about today, because it can be very confusing for someone who has to go down that road as they approach age 65 and figure out what they're going to need for the rest of their life. So Toby, we're talking about the Medicare Part D, which is for the drugs, and do people have to be concerned when they're picking a plan of what medications they're currently on? Does that factor into it?
Absolutely. The most important, you see, with the Medicare Part D prescription drug plans, each carrier has different medications on their formulary.
There's that word.
It's not standardized at all. I think it would be really great if it were, but we have to work with what we have. And I'd like to tell everybody what the definition of a drug formulary is, if that's all right.
Oh, absolutely. I want you to, because it can be confusing, because formularies are what the insurance company uses if they're going to be paying benefits. And, I would think that if you had a certain drug, you'd want to be sure that it was listed on the insurance company's formulary, correct?
Sure.
Okay, so go ahead and explain that a little bit further.
Yes, a drug formulary is a list of prescription medications. They're both, it could be generic, brand name. They're used by doctors to identify drugs that offer the greatest therapeutic value. So a committee of doctors, nurse practitioners, and pharmacists maintain this formulary. And again, each individual insurance carrier has their own formulary for the Part D prescription drug plan. So when I meet with people, the first thing I do ask them is if they're currently taking any prescription medications. And then if there are, then I have I go through all the different drug companies that offer the Part D prescription drug plans, and I see which one of those offer the medications, the prescription medications that the person I'm meeting with is taking. That's crucial, because there's no point in getting ABC medications on formulary from a company that, hey, none of my drugs are on that formulary. You have to make sure that what you are taking is in that formulary. That's what I really want to say. Yeah,
very, very important.
And so that's why, you have to know, you can't just randomly say, I think I'll take that carrier's drug formulary, because you'd be wasting your money.
Right, and a lot of formularies go more of the generic route now to save money, right?
Yes, definitely.
So if you're the kind of person that likes to, take brand name, you may not be able to do that unless you pay more or pay out of your pocket. So be careful of looking very closely at formularies. And some medications are so expensive that, the plan might cover it. It might be on the formulary, but the price you're going to pay for that premium could increase because of it, correct?
You're absolutely correct, Marcia.
Okay. Well, that's good to know. Very, very important. So, here we are with Medicare. We got Part A, we got Part B, we've got deciding between what kind of supplement we want. Then we got to throw in, medicine or a drug plan to cover all this. How does anybody even begin? Do you have a way for someone to have a tip, maybe, or organizing of how they should even begin to look at the differences?
Yes, I do. People, based on their health history, again, it boils down to what their health history is, what their medical needs are, and very, very important, their financial situation as well. Because you don't want to decide to get a certain option that, is going to make you insurance poor. You want to make sure that whatever option you choose is comfortably affordable.
Okay. So let's say somebody chooses at a younger age, 65, to go to a Medicare Advantage plan because maybe it's less money for them. They feel like they're getting more benefits because of the little extras they're throwing in. Is there any point in time, or have you come across any of your clients at any point in time where it might make sense for them to get off the Medicare Advantage plan and go back to what they call traditional Medicare?
You see, anybody that wants the traditional Medicare, which is Medicare Part A and Medicare Part B, you just need to make sure you have enough savings or an emergency fund that you can comfortably afford to cover that 20% that you're going to be responsible for.
Okay. Now, do the Medicare Advantage plans, if we're talking about the HMO kind, okay, not the PPO or the POS, but the HMO kind, which I think is one of the most popular ones, if I'm not mistaken.
It is. You're correct.
Okay.
Yes.
So don't they have what they call networks, and you must use physicians and specialists within their network only?
That's a great point. Yes.
So talk a little bit about that, the pros and cons with that.
Sure. I always like to make an analogy of Medicare Advantage plans to something comparable to when you have group health insurance. Whatever company you work for before you turn 65, you're with a group health insurance coverage. And within that group, you have provider network. If you stay within the network, it's always much better dollar-wise. If you go out of network, it is going to be a lot more money, or sometimes certain group health insurance plans, you have to pay 100% out of your own pocket if you go out of the network. So that's comparable to what the Medicare Advantage plans are. If you stay within their provider network, then the cost, you're gonna get the best bang for your buck.
Right. So, so one of the things, again, one of the components of choosing a plan might be, are my doctors participating in this particular plan?
And the challenge is with a Medicare Advantage plan is that all of the providers, doctors, hospitals, skilled nursing facilities, rehab, urgent care, have the option of opting out at any time. So in other words, let's say you sign up during the annual election period, which is October 7th through December 15th, with a January 1st effective date. Come February, your primary care doctor has opted out of that plan. And come June, the hospital that you would want to go to, if God forbid you have to be hospitalized, is no longer in the provider network. So you have to, you have to understand that when you do sign up for any Advantage plan, all of the providers have the option at any time.
So that's a risk that you're taking in a way.
It is a risk, sure. Yes.
So I think a lot of people think, well, I'm just going to go to traditional Medicare because then I can go to anybody I want. But again, the pros and cons.
Right. And here's another thing, Marcia, which a lot of people are not aware of. let's say you start out at age 65 with an Advantage plan, and then let's say 3-4 years later, you don't want the plan anymore, the Advantage plan, or they have the right to say, hey, it's a yearly contract. It's year to year. So let's say they decide for whatever reason they don't want you in the Advantage plan anymore and you're out. And let's say you say, hey, something, I think I'll try a Medicare supplement. Well, you have to medically qualify for a supplement. So you have to be underwritten. You have to go through a series of questions before they will approve your application for a supplement. It's not just like saying, okay, I'll fill out this application and I'll get a Medicare supplement. You have to health-wise qualify.
So what does somebody do that has a lot of health issues and, they're a big mess, health-wise? Are they still able to get coverage?
You mean when they start out at age 65?
No, later when they switch over and they want to get a supplement.
If they have a lot of medical issues, then unfortunately, they're probably not going to qualify for a supplement.
Because they have strict underwriting rules, right?
Yeah, that's exactly right. Mm-hmm.
Yeah. There is so much confusion about that,
I know.
So obviously, someone like you deals with it every single day. You see this, and it's so confusing that people need, a person to kind of walk them through it, because it can take weeks, if not months, just to try to analyze all this information. It's really overwhelming sometimes, especially for people that have a lot of other things on their plate, like, being a caregiver.
Right.
We're going to take our last commercial break, and we come back. I have a few more questions to ask Toby, so you won't want to miss the end. And she's going to give us some tips and a little bit more information of how you can better serve yourself and get the great help that you need. So we'll be right back.
Do you need the advice of an elder law attorney? Perhaps you find it difficult or overwhelming getting to appointments. The solution is Heidi Friedman of Becker and Polyakov. She brings elder law to you by meeting with you in the comfort of your own surroundings. In practice since 1994, Ms. Friedman is a member of the elder law section of the Florida Bar. She and her team help families with issues that include estate planning, asset preservation, incapacity, veterans benefits, and other legal issues that seniors may face. Call Heidi Friedman at 954-364-6021. She brings elder law to you. Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CaregiverSolutioms.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
I'd like to take this opportunity to thank our national sponsor, Arden Courts Memory Care. Arden Courts has many assisted livings, because that's what they do, is memory care assisted living, across the United States. They actually have 10 here in Florida and about 50 sprinkled across the United States. And they are our sponsors and making this program possible. one of the things that Arden Courts likes to do is to offer caregivers additional resources. This is called the 36-Hour Day Book. It's a wonderful book about caregiving, about dementia, with lots of tips, lots of information, and a lot of explanation. I highly recommend that if you're a caregiver, you read this book. If you don't have it, Arden Courts would like to give it to you free of charge, and all you have to do is call their toll-free number, tell them that you heard about the offer on the Caregiver Solutions Info Show, and they'll be happy to get your name and address and mail a book right to you. So call them at 888-478-2410. Again, 888-478-2410, and get your free copy of the 36-Hour Day Book. So on the phone with me today, calling in and talking about Medicare benefits and trying to help us understand the ins and outs and the do's and don'ts is my guest, Toby Saval, and she's on the line with us today. And so, Toby, a lot of times when I'm talking with customers, with new people coming in to sit down and talk about needs that they have for their loved one, and they need care for their loved one, one of the biggest questions that I continue to get is, well, doesn't Medicare pay for some assisted living? And people are still confused about what Medicare pays for, what Medicare doesn't pay for. And I explained to them that, no, Medicare does not cover assisted living, not in Florida, not in any state. It is private pay out of pocket. But what Medicare does pay is if your loved one sees a doctor in the assisted living, and that they can bill that to Medicare as if your loved one was in the office, but yet they're in the assisted living. Medicare will cover that if your loved one is on Medicare. People are still confused about other things that Medicare might cover. What other things do you hear, Toby, from your clients?
As far as what Medicare covers?
Right. Are they pretty much up on it, or they're not quite sure? Because a lot of people think maybe, hearing aids are covered.
No, yeah, hearing aids are not covered, unfortunately.
Right.
That's an excellent point, an excellent question. There's still a lot of confusion about what Medicare covers. And I want to give you an illustration of something that happened to one of my clients about 2 years ago. She went to her doctor for her annual visit, and based on blood work, he realized that she's a diabetic. So he wrote out a prescription for her to see a nutritionist. So she was very happy, to learn about her new diabetic diet. So she went to a nutritionist and very pleased with the nutritionist. She answered all of her questions, gave her the diet. She was perfect. A month later, my client received a bill in the mail for $250 for the consultation with the nutritionist. And she was shocked. So she called her doctor's office and said, how come I got this bill? And the doctor's office informed her that, Medicare doesn't cover a consultation with a nutritionist when you're diagnosed with diabetes. And she was very, very upset that she was not told that in advance, nobody told her. So I always advise people that whenever they're given some kind of test or procedure or consultation, they should always confirm with the doctor's office that it is indeed covered by Medicare, because they need to know the options. Like, if they don't have the $250 to pay for the nutritionist, what are my other options?
Right. At that point, if you find out it's not covered by Medicare, you do have options, because you can say, well, how important is it that I need to do this? But if it's still important, I think at that point you could shop around, because there's nothing wrong with shopping around for insurance, right? For our health. For health insurance even.
Sure, you're right. Absolutely.
Yeah.
So I just want people to be aware that just because a prescription is written out for something, most of the vast, vast majority of things are indeed covered by Medicare. Absolutely. But here and there, you're going to find a test, a procedure that is not covered. So I always advise people just to double check, either with their doctor's office or the people I work with can always call me, or they could always go on to the Medicare.gov website or call Medicare and say, hey, my doctor ordered such and such procedure for me. I just want to confirm Medicare covers that.
That's a very good point because, again, Medicare doesn't cover things that we might assume it does. So better to be safe than sorry on that. So,
exactly.
Toby, before we end, we still have a few minutes, but I want to give you an opportunity to explain to our listening audience about how you work, what you do, how you can help someone through this maze, some of the benefits of using a specialist like you, and then tell them how they can contact you.
Okay, thank you. Basically, I meet with people either in their home, whatever's comfortable for them, my office or Starbucks, wherever they're comfortable. And I learn a little bit about their medical history, medication, prescription drug history, and their family history. And then after we assess all of this, I get an idea of what their financial status is like because, again, there is a monthly premium for a Medicare supplement, and even some Advantage plans do have monthly, not all of them, but some of them do have monthly premiums. And then basically we sort through, based on finances and health history, what might be the best options for them. And basically, with my medical background, I also have an extensive medical background. They find that very helpful as an added value to them. I still maintain, I'm very proud of this, my Florida RN license. So I bring to the table the medical knowledge as well as the insurance knowledge.
Wow, so you get a twofer with Toby.
Yes.
And then you help them sort through then of all of the options, which one is going to be best for that. So basically you customize the selection, right?
I do, exactly, yes. And I, just make sure that they're not going to go over their heads with a payment they can't afford. I want them to be comfortable with whatever decision that they make financially as well as medically.
And so how would somebody go about contacting you?
Okay, my phone number is area code 561-358-4454. And my website is www.savalinsurance.com, SAVALINSURANCE.com. And my email address is toby@savalinsurance.com, TOBY at Saval, SAVALINSURANCE.com.
Okay,
so by email, by phone, or website.
Any way to contact you is fine with you, right?
Correct.
Okay. So, if you're listening to this and you have questions about Medicare, about Advantage plans, about, what's covered, what's not covered, if you're approaching 65 and you think, I don't have time to do this, call Toby. She's a wonderful person. I know her personally for many, many years, and she definitely will help you. She's got a good heart, and she's all about helping people. So give her a call. So thank you for joining us today. It's been really my privilege to be here and have you join us, and I hope that you'll be back next week, same time, same place. In the meantime, don't forget, give somebody a hug because they need it, and so do you. And thank you again, Toby, for being here.
Oh, it's my great pleasure, Marcia. Thank you for having me.
All right. Well, everybody, have a great evening. Take care.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teele. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on CaregiverSolutioms.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more Caregiver Solutions. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life.